Hello again, and thank you for joining us for another COVID-19 update for you and your community right here on the Bass Coast. Joining you today is Dr. Dan Crompton, Clinical Director of Emergency Services at Bass Coast Health. Dan, hello and welcome.
Hi, Kevin.
So, Doctor, during this pandemic, every department at the hospital needs to be prepared. Tell us how the emergency department at Bass Coast Health has changed during COVID-19.
Thanks, Kevin. So we've taken a number of measures to change the way that we manage patients in our emergency department. That really starts at the front door, where we're now screening patients before they even come into the hospital to see if we suspect that they may or may not have coronavirus. That helps us to stream people into two zones, one of which is a zone where people might have coronavirus and another is where we think that they don't. And that's one way that we've really changed the way in which we're approaching the arrival of patients to our hospital. This process is going to change again probably in the middle of May, where we're going to be separating our patients further into two different parts of the hospital. And there'll be more information coming out about that closer to the time.
So can I take it then any suspected COVID-19 patient will go to ED first for assessment? And if that's the case, do you have a specific team to deal with that?
So we currently have an assessment clinic in the hospital. So patients that are not too unwell and may just need a swab and go home will be seen in our assessment clinic. Any patients that are more unwell, either with or without symptoms of coronavirus, will be directed to the emergency department. We have two zones in the emergency department currently we're seeing patients. One for patients we suspect, and they're dealt with by a separate team of nursing staff. The medical staff are still shared across the cold or the suspected and the non-suspected zones, but every precaution is taken to make sure that before entering and exiting those zones, the staff are wearing appropriate levels of personal protection to protect themselves from any possible infection, and then taking that possible infection with them when they leave that department to see other people.
All right, so now that you've said that, that's quite clear when you get to the hospital as to where you should be at any particular time for anyone who just goes up there for the very first time?
So when you arrive at the hospital, you're greeted by some staff at the very front door before you even get in. So it's quite clear because they will guide and direct you to the appropriate zone to go to. And that system will continue when we have our new system of even more separate locations for patients.
All right, so during this time of staying at home and physical distancing, I'm wondering whether there has been a change in the number of people presenting to the emergency department.
Well, Kevin, it's really interesting that actually we're seeing much fewer patients presenting with the average conditions that you'd expect for this time of year, for patients with all sorts of conditions. And really only the most unwell people are coming to hospital. And people are choosing to stay at home if they don't have a truly emergency condition. And this pattern is being seen across the country and even internationally in areas where coronavirus has become a problem.
I suppose people are less at risk and they're doing not as many things outdoors or travelling, and so that would reduce the number of incidents that might happen.
So I think that's true. I think to some degree the social distancing certainly is helping to reduce the amount of respiratory illnesses people are experiencing. And perhaps the amount of car accidents, the amount of accidents occurring in workplaces and other things are less.
Okay, so finally, how are you and the rest of the ED team coping with all the changes that are happening in the emergency department? And is there anything in particular that is difficult or different that you're having to deal with on a daily basis?
So at the moment there's a lot of uncertainty, and I think for my staff that's the biggest concern that they have. We're working very hard to prepare the emergency department to deal with a significant increase in the number of patients that are coming through that we're seeing each day. The preparation and planning that we're going through is taking a lot of time and effort of people so that they're prepared and ready to deal with the patients that will be arriving soon, we think.
Yeah.
So we're a very close-knit team in the emergency department, and we're quite used to supporting each other through stressful situations, clinical, personal, and I think we deal very well with that as a team. At this time, obviously, we're making sure that we're all okay and checking in on each other regularly, and we're really encouraged by the community response that we're noticing. That people are doing what they've been asked to do, and we really appreciate that.
Great. Dr. Dan Crompton, thank you very much for joining us today. Dr. Dan Crompton, who is the Clinical Director of Emergency Services at Bass Coast Health. Thank you for viewing. Keep sharing us on Facebook, and until I see you again, take care.